Hello, my name is Brandon Myers, and today I'm going to talk to you about kidney transplants. So, did you know that in 2015, nearly 31,000 kidney transplants were performed that year? Today, my purpose is to teach you about the function of the kidney, the history of the kidney transplants, and a little bit about the modern procedure and the modern surgery. First of all, what is a kidney? Well, the kidney is an organ, and each of us have two of them. It's about the size of a fist, and it's located in the back of the abdomen. So what does the kidney do? The kidney's basic job is to filter blood, and with that, it keeps balanced fluids in the body, and it also regulates electrolytes, as well as turning that waste that it gets from the blood into urine. So some things that could cause kidney damage and eventually kidney failure is bacteria, an overactive immune system, kidney stones, diabetes, genetic disorders, and actually many other causes. So, the first kidney transplant was performed in 1954, and it was performed by Dr. Joseph Murray. And actually what happened was there was a pair of twins, and one of them was having kidney problems, and the other one had a perfectly good set of kidneys. So because they were twins, their kidneys were so identical that they were easily able to move it into the other twin's body without rejection, which is what we're about to cover now. So when you don't have a twin donor, like Richard was lucky to have, then sometimes the kidney doesn't match up, so there are kidney problems of like rejecting the kidney as a foreign organ, you know? So what happened was they needed to suppress the immune system that would fight off the foreign organ, right? So what they were doing is they started off by using radiation in the early 40s, but they found that the radiation, although it lowered the immune system, it actually damaged the patient and often killed them. And then after that, they invented a medicine in 1959 called Imarin, and that would suppress the immune system so that it wouldn't attack the new organ, but it also didn't cause any lethal side effects. And around the 1980s, there was a new one called cyclosporin, and that's far more effective at both suppressing the immune system without hurting the patient. And that's the one that we use today. So today, basically how it works, if you do get kidney failure or do get bad kidneys, then you'll have to get a donor, which can be a living person or it can actually be a recently deceased person. And they'll make sure that the tissue type and the blood type match up so that your body will accept that as a new organ. So the surgery usually lasts about 3 hours, and what they do is they attach the donor kidney to your blood flow and your bladder so that it can work normally. And usually, actually, the old kidneys are left in unless they're causing some serious problem like a really large cyst or cancer that could spread to other parts of the body. And recovery. So most patients stay in the hospital for about a few days, unless it's a severe case in which the organ still isn't good at producing urine, so they'll have to stay on dialysis in the hospital for longer. But patients actually have to take immune-suppressing pills for the rest of their life so that the body still accepts that organ and treats it as one of its own. But problems can occur, like acute rejection is just when your body's starting to think of it as a foreign body, so they give you stronger immune-suppressing medicine. And chronic rejection is whenever the new kidney loses all control, it completely fails again, and what you can either do is go on dialysis, or you can just get another organ transplant. So yeah. Oh, and also, due to the immune suppressants, patients will be more likely to get ill like colds and cancer because their immune system, of course, isn't as strong. Today, I hope that I taught you about the function of the kidney, the history of the kidney transplants, and a little bit about the modern procedure. Thank you.